Bonjour. Je vous souhaite la
Hello
bienvenue
and
dans
welcome
votre
to my
cabinet
office and to the wonderful world of microscopes. To start with, let's remember that it is our visual capacity which is limiting our manual precision. This is why, today, most dentists use magnifying tools to improve the precision of the movement, inasmuch as the delicacy of our motricity allows it. I'm very happy to tell you about an instrument which has deeply changed my life as a dentist and could soon change yours too. If you already know the microscope, but have not really adopted it, I will try to make it more attractive to you. And if you own one, but use it rarely, I will try to make it more sympathetic and essential to you. Let me show you what I would have loved to hear in 1999, when I found myself alone with a patient, facing a microscope which had arrived the day before, without any further preparation. During the following days, I didn't know if my attempt to replace my magnifying glasses would make sense and if I would succeed. I went through moments of erring, discouragement and doubt, and I worried if there would not be side effects to work permanently behind the eyepiece. We must remember that, at that time, few generalists used the microscope permanently, and I knew none. Fortunately, today there are introduction courses based on many years of experience with the microscope in dentistry. Furthermore, we know now that in addition to an extraordinary vision, and therefore the improvement of precision and quality of work, this tool is also beneficial for the health of the practitioner, since it makes him work in a physical position which is better for his back. In addition, the microscope makes the eye look to infinity, therefore it is restful and more so under a good light. And this even in the darkest places of difficult access in the mouth, where the naked eye with magnifying glasses gets quickly tired and often produces a poor result. I would like to accompany you in the discovery of this instrument and then in the first steps on the patient during the progressive adaptation of the microscope in all your operations and in all quadrants of the mouth until it replaces your magnifying glasses. However, using magnifying glasses is not a compulsory step for passing onto the microscope. If you choose to follow me, your professional life will enter a fourth dimension. You will discover new physical comfort and higher working satisfaction, not only because you have learned a new technique, but above all for having improved the precision and the quality of your work. This innovative approach is a new pleasure every day for all the years of practice which lie ahead of you. Again and again you will tell yourself, without the microscope I could never have been able to perform this treatment. Sitting in your chair, you will never find the vision from behind your microscope commonplace. The passage from your usual vision to the magnified one will each time bring you more ease and delight in your working field. The use of the microscope doesn't demand big changes in the habits of the practitioner. Keep the good ones, and it is a chance to get rid of the bad ones, in particular bending over or other bad body positions. To obtain this, you will often have to turn to indirect vision, but, as we will see later in these videos, indirect vision is often possible if the patient is in an appropriate position. On the other hand, working with 4 hands is essential for taking advantage of the benefits offered by the microscope, even if it is sometimes possible to practice alone, especially in endodontology. In particular, this allows especially receiving instruments in the hand without the eyes leaving the operation field, which is very profitable on the ergonomic level. It is not my purpose here to show new techniques in the operatory act, nor exceptional results, but to show you the possibilities of exceptional conditions for executing current acts. To avoid unpleasant theorizing, the global approach and the detailed demonstrations for mastering the microscope are practical. Everyone will be able to use the demonstrations for applying them to his own techniques of treatment, from the most simple to the most sophisticated ones. Viewing the video will also be useful to your assistants for suggesting the movements they are not yet used to perform, and also to reassure them on introducing this new instrument. I will start a short presentation of the microscope, essentially addressed to those who don't know it at all. I will show the way to approach it, considering that there are various types. Then we will see different types and brands of microscopes available on the market with their accessories, so you will have the basic knowledge of what is important in dental practice when choosing one. We will also treat the question of placement of the microscope and its various types of support according to the configuration of your office. With the help of the synchronized double image videos, one of the crew, the other of the microscope, you will notice that it becomes possible to use the microscope from the beginning to the end of a treatment, and this in each quadrant of the mouth. I will not show interventions of a radicular treatment, the microscope being already well introduced in this approach and having become a standard practice for endodontologists. You will have plenty of time during the videos to see how you can adapt and use your microscope in different places of the mouth cavity. I will comment each time on the difficulties you could encounter and the means to solve them. This way, you can imagine how you will proceed in your environment and with your own working habits. The following videos have been taken during regular activity of the office without any special preparation, except asking the authorization of the patient. They reflect daily activity. I have chosen 1 or 2 cases for each quadrant, trying to vary the menu. The comments have been added following the action when editing the sequences. I have myself been surprised to discover some of my gestures when seeing them, which allows me to really transmit the explanation of my way of working with the microscope without elaborating theoretical explanations, while being aware that other methods exist. But now, let's discover the microscope.